Good morning. This is your daily coronavirus update from Coronavirus Central here in Pennsylvania. So let's look at the prevalence per 100,000. Just to refresh your memory, we divide the number of existing cases by the total population value and multiply by 100,000 to give it perspective. So in Luxembourg right now, and this is based on today's data available from Johns Hopkins University, their global coronavirus tracker. If you've been watching my videos, you can find a link for this, or you can just Google it. Luxembourg, wow, for a small country, has 77 people per 100,000 basically. Italy is second, Switzerland. Well, these countries are very close to one another. Spain, Norway. So, and I highlighted all countries with prevalences above 10. There's South Korea. And looking at change from yesterday in terms of this prevalence value, slight decline in South Korea, which is cool. In terms of case fatality, these are the number of individuals who died divided by confirmed cases, and it's highest in Italy with 8.6%. So your probability of dying if you have the coronavirus in Italy is 8.6%, and it's 7.3% in Iran. Everywhere else it's quite low. Let's see, Spain it's 5%. And then let's look at our country here in the United States. Right now we have basically six people per 100,000, and that's an increase by 1.6 people per 100,000 from yesterday, and our case fatality rate is 1.3%. So hopefully this put things in perspective. Let's look at China. So China was obviously where this all started from what we know, and their case fatality is 4%. So this is where we were when I remember when we started talking about this a few weeks ago. And I was in one of my classes. Maybe it wasn't even a few weeks ago. Maybe it was 2 weeks ago. I can't remember now. Time is standing still for me, or is lost because I've been at home all the time. I thought, okay, well, 3 to 4%. That's where it's going to peak, and that's where it peaked in China. If you look at Italy, it's 8.6%. One of my goals is to analyze what's going on in Italy and why it's so bad in Italy. There's a lot of issues. I actually found that the first case in Italy was confirmed around February 20th, although this person first detected being ill himself February 14th, and he probably got it somewhere in January from what we've learned, or he was exposed to it sometime in January. We know that the incubation period is somewhere like 14 days, up to 14 days. I've read a case where it was 24 days. It was in China. So it's probably about 14 days. So Italy did not, the Italian government is mad at the hospital that saw the individual because they didn't take him seriously at first, or they did, but they didn't think it was coronavirus. It's interesting, hospitals do this all the time. So this isn't just about coronavirus. I could tell you stories from our family that had issues like that with other cases. So you never know with the hospital. If you really feel sick and you have to trust your healthcare providers, but a lot of people won't. And if you have underlying conditions, you should push them further until they really diagnose what's going wrong. In terms of the United States, looking at states, I added a few states here. I added Illinois, New Jersey, Maryland, Virginia, and then I added the District of Columbia. That's where I'm from. So these are blank because there's really I didn't look at them yesterday, so that's why there's no change. New York has the highest prevalence per 100,000 now. It's like 43 people per 100,000, followed by Washington State. However, the case fatality rate remains highest in Washington at 5.4%. Change from yesterday, there's a big change in New York versus Washington. Let's see. Anything else interesting here? Well, Washington D.C. Washington D.C. This is not per 100,000. This is per 10,000. I changed the rate base because it's a city, and it's a relatively small population. So I don't want to inflate those values or occlude what's going on. So it's better to do it per 10,000 people. for a city. So that's what that 5 stands for. It's per 10,000 individuals. So this is all in ascending order. Anything else that's interesting here? Florida, nothing really major different here. In terms of odds ratios, so I've been calculating the odds of person having or being infected with this novel coronavirus and having COVID-19 coronavirus disease in Washington State versus New York. As you know, when we started, it was much larger in Washington State than New York. Now the odds of encountering somebody in Washington State are 1 minus this, which is 57% lower than the odds of encountering someone in New York State. And this difference, this odds ratio is significant because it does not cross 1. If you're not really sure what that means, then you should look at one of my other videos. But an odds ratio is the odds of one region divided by the odds of the other. So if they're equal, it'll be 1. It's like a 50-50 chance, basically. And okay, let's look at some, some other interesting figures here. These are my daily figures. So this is what we see in the United States. If you notice from 17, 18 to 19, there was like this increase. It seems like the rate of change seems steady right now. I'd have to do some more calculations for that, but it looks pretty steady. So maybe there's a turn here. I don't know. We'll see. We'll wait till tomorrow and see if this continues to stay at this rate rather than having this high slope. Now I compared the United States and Korea, and well, here's the interesting issue. The first case in Korea and the United States were detected on the same date, and most people are making a big deal about testing. I'm making more of a big deal about these curves. If we were detected on the same date, look at our curve in the US versus Korea. The cases, the prevalence per 100,000 is massively larger in South Korea than it is in the United States. And again, as I said yesterday, people could argue the Yabet people is that we're not taking population density into account. Again, and to counter the Yabet people, I would say, well, this is the United States, this isn't South Korea. Our population density is what it is. This is looking at what's going on in New York versus Washington State. As you can see, the prevalence has been steadily increasing, but a very gentle slope for, this is like a bunny trail in skiing versus a black diamond in skiing, right? So in New York, it's increasing, as you see. And again, here I'm watching this change in the slope as we go on. Hopefully this will kind of level off soon. So what's the bottom line here? I can't tell you, and nobody can tell you exactly what's going on, except for that we're obviously dealing with it. And the important message is that, and I know people want answers, and they want answers now. In medicine, one thing I've learned in medicine, it's not from, I'm a PhD, I'm not an MD, but one thing I've learned from having family members who've been sick is that sometimes there's just no answer, and you have to be okay with that. You have to understand that the professionals are working on these issues. They're doing their best they can. They're slaving in these labs hard to try to find the best tests, find the best treatments, vaccines, and everything like that. And you just gotta wait and be patient. Stay at home, do what you're told, and everything will be okay. And stop panicking and begging for answers that people don't have. And it's okay that they don't have the answers, because if you start giving answers and you're wrong, conditions could be a lot worse. So I hope you have a wonderful day, and I'll see you tomorrow.